Am I audible? Are things okay? Is the audio and video perfect now? Can we proceed with the lecture? So good evening, all of you. Wishing you a very happy Mother's Day once again. And this year, it's a special Mother's Day for me, myself, Dr. Smital Joshi. So Dr. Taiba has already given my introduction. Without wasting time, we will definitely proceed with the session. Yes. Again, I would love to be very thankful to my children to give me this designation of a mother. My children, Ishank and Ayansh, thank you very much. And definitely a very big thank you to our Master Samuel Hahnemann, who is the founder of homeopathy. And definitely tribute to my teacher, my mentor, Dr. Prafullvijayakar sir. So welcome everyone to our special session on Mother's Day. Definitely we honor and appreciate the remarkable influence of mothers worldwide. Let's delve into the significance of this special day and why mothers deserve our utmost recognition. In Marathi, we used to say, "Ai hi माझी आद्य guru आहे." So she's my first guru. So definitely before starting the lecture, I would also uh, love to thank my mother. So who is a mother? Definitely everybody will tell me a mother is somebody who gives birth to a child. But it's not only a birth. It's not that she only gives birth, but she raises, she nurtures a child. So, in fact, we can say that it's actually a child who gives birth to a mother. The essence of motherhood lies in the unconditional love, support, guidance provided to children. Nobody can replace a mom. So today we are here to discuss about motherhood, about a mother. What are the challenges that she faces? What are the struggles? What are the sacrifices she does at every stage of her life? So motherhood starts from the day when she realizes that she has conceived. Okay, and it continues till it goes on and on and on. There is no end to it. I'm sure everybody agrees to it. Yes. So today we will be discussing different phases of motherhood. Since it's a special day, we want to dedicate it to all the mothers. Just to have a basic idea, definitely I'll not go into much details. But any questions, any doubts, you all can just put them up in the chats and we will get back to you. So during the lecture or during this session also, if you have any doubts, um, as and when you have doubts, you just message us and we'll answer the same. So, talking about different phases of motherhood, as we discussed, that motherhood starts right from pregnancy. Okay, the day the female realizes that she has missed her periods, and that definitely she confirms it with a pregnancy kit, then so that is the first phase of motherhood. Then there comes post pregnancy, postpartum for a female, and then definitely we no longer define motherhood by her stages of life, but then it put the stages in which she raises the child through the different stages. And definitely motherhood just continues. Okay, so now coming to the actual topic, when we are discussing about pregnancy, what are the different problems a female can face? And okay, tell me the normal symptoms or complications or problems that a female faces during pregnancy, during the 9 months of pregnancy. Yes, I know these are just basic questions. We'll go into details of each and everything. Yes, anybody? What are the symptoms during pregnancy for which a female mother would like to get some help through treatment or anything? Yes. I'm sure there must be some doctors, or of course, there would be mothers attending the session. So, what are the different issues that you face during pregnancy? In the chat. Okay, so here we have certain answers like morning sickness, mood swings, hyperemesis gravidarum, new changes at the level of mental and physical aspect. Yes, so definitely we have all these symptoms, wherein majority what we are seeing is we are uh, complaints of physical symptoms more like vomiting, not able to eat food, lot of acidity, gas, uh, hyperemesis gravidarum, which means there is a lot of vomiting, or there is hypertension, blood pressure, and diabetes during pregnancy. So here, majority usually, as doctors, we know. But if you ask a lay person, for them only physical symptoms exist during pregnancy. Nowadays, because of the awareness, definitely they know that there are a lot of mood swings during pregnancy. So there are a lot of hormonal changes in pregnancy. So for physical symptoms, definitely we have medicines. We for vomiting, medicines are given. For every physical symptoms, medicines are given. But when we are talking about mental issues, nobody talks about mental issues that they face during pregnancy. Okay, so first we'll talk about during pregnancy issues, then we will come to postpartum issues too. So, just a small discussion, not in detail, but when we are talking about physical symptoms, okay, uh, blood pressure, we are talking about diabetes, vomiting. Do you think these physical symptoms are same in every female? Every female is different. Every For them, every symptom is different. So motherhood is also different for different females. You cannot expect the same signs and symptoms or the same experiences that one pregnant female will experience and the other. The experiences would be totally different. Okay, so for us, we want to highlight that even every physical symptom is the resultant of a mental conflict. To explain you in simple words, like, okay, usually, you must have heard this statement. Blood pressure बढ़ जाएगा गुस्सा मत कर. Now what is the relationship between getting angry and the blood pressure increasing? Okay, so whenever you get angry, there is a neurotransmitter which is released, adrenaline, which goes on the kidneys. It acts on the arteries of the kidneys. It constricts the kidneys, which restricts the blood flow to the kidney, thus increasing the blood pressure. Okay. So with anger, there is adrenaline released. So with every emotion, there is a neurotransmitter which is released. So emotions do play a very, very important role for us in homeopathy. Okay, you must have heard that dialogue in Munna Bhai, wherein Dr. Asthana, it's the first few days of their, the new students, freshers have joined in, and Dr. Asthana just happens to ask a female that why do you think you can become a good doctor? And she answers, I can become a good doctor because I think I can understand people, I can feel the emotions of people. Okay, and wherein Dr. Asthana clearly said in homeopathy, in their world, emotions don't exist. Emotions make you weak. And the dialogue was so on. But in homeopathy, emotions are the most important thing because we think for every little ailment in the body, it is the emotion which carries out the effect. So it is something, you take care of the cause and the effect will take care of itself. So it's not that the emotional something, for example, you are a person is angry because of something and therefore his blood pressure rises. So it's not that he will never get angry with that sensitive emotional issue or something, but it would be more the anger sensitivity would be taken care of. This is where homeopathy comes into picture, that emotions will be taken care of. Further, when we go ahead in our presentation, I will show you even books of pediatric. There are certain pediatric books which have acknowledged that certain endocrine disorders, they in children, they start in the womb of the mother. Okay, right now I'm not just talking about, I will be covering not only about ailments the mother would be suffering during pregnancy, but in the end, we will also talk about how mother's emotions affect the children. Yes, mother's emotions during her pregnancy, when the child is in her womb, the emotions do affect the child. Okay, that is why we advise females that they should be, happy. They should be away from any stress. You should be away from all the negative emotions. You have to think positive. You know why all this has been advised to a female who conceives? Because the effect is on the child. Okay, coming back to the mother's pregnancy complaints. So what all complaints? Definitely we talked about morning sickness, hyperemesis gravidarum, all this. So accordingly you have to find the cause in the mother, like what emotions have affected her. Tell me, what are the different, if we talk about more about mental mood swings during pregnancy, what are the different mood swings that you can face during pregnancy? How does the female present? Yes. Yes, you can answer through the chat so that we can carry our discussion further. Okay, easily irritable. Very good. It's just the irritability. What else? So, yes, it would be easy irritability. There would be change in sexual desire and aversion, definitely. Feeling low, does not feel like talking to anybody. More weeping without reason. Yes, sometimes happy, sometimes sad without any specific reason. So here comes the understanding of the family. So, how beautiful our culture is, wherein it has been, designed in such a way that fifth month or seventh month, depending on the different cultures, rituals, god bhai is done, and baby showers, that is done. And after that, the female is sent to her mother's place so that she's not, affected mentally or physically in any way. But nowadays it's the other way around, because it's more like a nuclear family, or it's not possible for the female to go because of her daily working hours and many other reasons. So these traditions have been changing. Anxiety about delivery, yes, excellent. Some have, lot of anxiety and anticipations if it's their first delivery. uh, what will happen, how will it happen? So of course even that will, release a neurotransmitter and affect. So how to tackle all this? Definitely you should, you know First of all, definitely our grandparents and parents who are experienced, they will definitely guide us in all these phases of pregnancy. But still, if you all how to tackle, definitely counselors are available, or various courses are there which are done so that the facts are being told about the delivery, and how to wave off your anxiety. See, it's not that I'm telling you that you go for all those courses, but just realization of the facts may relieve your anxiety levels, that this happens with every female and these things are normal. Okay, so even that can affect. And definitely homeopathy can help again, because homeopathy understands the sensitivity of an individual. So always, Dr. Prafullvijayakar sir used to give us an example. If there is a leakage somewhere, you know, you cannot just, from the place where the water is leaking, you cannot just plaster that part. You need to actually find out why the leakage is there. Okay, so why the blood pressure is there, you're not going to find what made the blood pressure high for them. Increased salt, eating this, that has caused the blood pressure. No, you need to find out why it happened. So answering the cause will take care of the effect. So when you understand the emotions, so homeopathy helps you excellently in understanding the emotions, and thus helping you out with these problems in which the other mode of treatment is not available. Okay, so these are changes which you face during pregnancy. Now, let us discuss something about postpartum. Okay, so first phase of pregnancy, first phase of, sorry, motherhood, which is during pregnancy. We understand what all problems a female faces and how to tackle them. Any questions? Please let us know. Definitely, homeopathy can help you out. If you all want details, we can take separate lecture sessions for that too. But then you need to let us know what things you all are interested in knowing. Okay, so talking about next is postpartum complaints. Okay, so what complaints a female can face during her postpartum part? Yes. Yes. Postpartum is after her delivery is done. What are the physical or mental issues a female who has just delivered will face? Yes. Somebody mentioned weeping, not wanting to feed children. Okay. Now I have a case wherein the female was not ready to look at her children. She was not bothered. She used to remain in another room, and the children were in other room. She was not keen on feeding the child. She was not, she was not wanting to take care of the child. Yeah, no milk for feeding after delivery is definitely common, but not having a connection with the child that you have just delivered, and it's just your first delivery, you're not feeling connected. In fact, it was not only that she didn't have connection, but she also had a hatred for her children. So these mood swings, this is again postpartum depression. Okay, so how to tackle these kinds of things? In homeopathy, we can help you out in various ways by understanding why the female developed this. Okay, so there can be various reasons for the female to have that hatred. Maybe in childhood, she herself faced it, that she was not being loved by her mother, or moreover, you will find the cause in the pregnancy itself. Of course, you have to look at the past history, whether she had that liking for children or no during her pregnancy phase, and this was just a phase in postpartum. Because postpartum also there are a lot of hormonal changes which are taking place in the body, and which gives rise to such behavior from the mother. So what caused this uh, hormonal imbalance? Definitely after delivery, in every female these hormonal changes takes place, but every female doesn't behave in such a way. So definitely there has to be a cause, and you treat the cause, definitely the patient will improve. Okay, so postpartum hemorrhage. Again, if there is excessive bleeding, there can be various causes for excessive bleeding after delivery. You know, there can be placenta previa or cord around the neck, which cause excess bleeding. But we as homeopaths know in which direction to ask the patient, because we have seen so many cases of postpartum hemorrhage wherein we have seen that there has been excessive anger in mother, or excessive you can say definitely anger on something. Either the anger was suppressed or it was expressed. It has to be more, it has to be a expressed anger for bleeding. Okay, and then we give medicines. There have been cases which have improved excellently. The doctors were amazed, like how did the bleeding stop, since it was not stopping with their heavy doses of antihematamics. Still the bleeding was not stopping. Okay, somebody said there would be females with trouble sleeping. So definitely there is something which is bothering her. So we need to go into more and more details of our case taking and find out the reason. See, it's not that when we are considering uh, the emotions of a patient, we are, it's not that, we also definitely look into for invest proper investigations, proper analysis of physical issues also. And definitely, you know, even emotions are, taken into consideration, because when you are talking of a person, when you are talking of a cell, when you are talking of a gene, it does not only determine what physical complaints you are going to suffer. It's not going, it does not only determine your, how are you going to look, how are you, how tall you would be, what color eyes you would have. So it determines your physical structure, it determines your mental nature, like you will be, happy go lucky like your mother, or you would be very studious like your father. So in genetic, when you are you have the traits, it is physical, it is mental, and also what diseases you are going to suffer is predetermined. So if a genetic code determines all these three, if you have to, really help a individual out with proper medicines, then you cannot just treat them physically. Again, a quote from Mona Bhai, he says कि हड्डी के डॉक्टर को पता नहीं होता है कि यहाँ क्या चल रहा है. आमिर खान also beautifully quotes कि after that person commits suicide in Three Idiots, कि यहाँ का प्रेशर देख लिया कि the death is because the cause of the death was by sorry, the cause of the death was by hanging. But he says we know the pressure cost here. Nobody knows the pressure cost which was here. We never give importance to this. It's not that our body just consists of the parts below the neck. There is something above the neck also, which is the most important part. जिसको हमेशा हम like we don't pay attention. Yeah, any other issues postpartum and any other questions related to postpartum? Sorry. Like if you want to understand whether a female a mother can be helped out for those complaints during postpartum times. Half of the times, in fact, these issues are not addressed also. The mood swings, these are very important issues to be addressed. Okay, we go to the next, post pregnancy. Now, raising the child through the different stages. When we are talking about motherhood, okay, so initial phase is pregnancy, post pregnancy. Next comes, the role of motherhood, the struggles of motherhood, and what all things that she has to face, raising the child through different stages. Oh, yes, definitely. We'll go back to the infant and toddler and teenager. We'll talk about all those. But let me tell you about this thing, which is a very important point. How does homeopathy help? Okay, homeopathy helps right from conception. Even in infertility cases, homeopathy has a very deep understanding. Now, okay, in today's world, wherein females are trying to be in at par with the males, what is happening is, now if you read Bhagavad Gita, the biggest religion is our karma. Now what is your karma? So if it's mother, the karma is definitely to raise a child, to nurture the child, okay, and to shape his life. And then you work for the purposes of existence, definitely that's an other karma. But this is the karma for which you have come on this earth as a female. I know it is sounding very philosophical, but please understand the human female is designed such a way that uh, you know there are mm, uh, hormones like estrogens and progesterone which are there in females. Okay, everybody knows about it. Now when the female tries, and a female is supposed to be loving, caring, nurturing. So when a female tries to be aggressive, when a female tries to prove herself, or a female wants to be at par at males, that she wants to earn more, or she wants to earn more than her partner or something like that, wherein she is giving, what it is giving rise to, hormonal imbalance. When you're talking about hormonal imbalance, uh, it is estrogen and progesterone which go for a toss. Not only that, it is the testosterone levels which increase, giving rise to PCOD. In most of the PCOD cases, we go for which investigations? We go for DHA. We go for DHA, wherein the aldosterone level increases, which is a part of testosterone. Okay, so the male, because a female is trying to match up with the male half, the testosterone levels increase, because of which there are infertility issues. Okay, so I'm not saying that the female is not supposed to, because it is today's society's, pressure. Definitely because of the societal pressure and many expectations from a female, that the female is bound to go for all this. But remember this thing, your main thing is to conceive children. Once they are they are of a certain age, then definitely it's only that time period that you need to give for your child. After that you can definitely perceive your career, you can go ahead. Now what are the bad effects, or what are the repercussions of working parents? I'm not only talking about, I will not only be talking about or blaming a mother, because I'm myself a mother and I'm myself working. So but there has to be a balance. So we'll talk about this balance also. Yeah, we spoke about all this fertility, we spoke about this hyperemesis gravidatum, diabetes, mood swings, hormonal changes. Homeopathy also helps in postpartum depression, cases like lactation issues, postpartum depression, etc. So I was talking about how a mother's emotion can affect the fetus growth and development. In fact, it's not only affects the fetus growth and development. Now, this thing I have taken from pediatrics book OP High, which says that recent research, just read the highlighted ones. Recent research suggests that several of the major disorders of later life, including coronary heart disease, hypertension, type 2 diabetes, originate in the impaired intrauterine growth and development. Can you believe that a person who is suffering from hypertension, type 2 diabetes, and coronary heart disease, that is already, the origin is in the impaired intrauterine growth and development. These diseases may be consequences of programming, whereby a stimulus or insult at a critical sensitive period of early life has permanent effects on structure, physiology, and metabolism. The alterations in fetal nutrition and endocrine status result in developmental adaptations and permanently change structure, physiology, and metabolism, thereby predisposing individuals to cardiovascular, metabolic, and endocrine diseases in adult life. So imagine if these diseases are already predetermined in the mother's womb. So how much important would be a mother's history during pregnancy for the child's development? So we need to know in and out about mother, what she suffered through, like what emotions she went through throughout pregnancy, in the first trimester, in the second trimester, and in the third trimester. Again, when we are talking about Bodhparai and we are talking about baby shower, which is done, as I was mentioning, it is done at the fifth and seventh month, depending, in Gujaratis, sometimes it is done, some people do it in fifth month, some cultures do it in 7 months. So that is the structure and anatomy is formed. Now the body wants to welcome the new soul. So that is when that god bharai is done. So how beautiful, our culture is, wherein the first the structure and the anatomy is formed, and then the life, the functioning comes. Okay. So especially what, Dr. Prafullvijayakar sir has pointed out, that the emotions do affect in, 7th, 8th, and 9th months of pregnancy. Of course, emotions affect all throughout, but when we are treating as homeopaths, the history has to be taken accordingly. But most important for you to know is that emotions do play a very important role, because that determines everything. Yeah, so despite their strength, mothers face various challenges, including societal expectations. Like a mother is, there are a lot of expectations that a female is supposed to fulfill. Like she has to be good in cooking, she has to be good at all the work that she's doing, she has to maintain a work life balance, like she has to take care of the home also, and she has to do well in her career also. So imagine the pressure that a mother undergoes, and of course she has to take care of the child as well. So imagine the various emotions that a mother can undergo. I will give examples of various females who are going for work are under societal pressure. Females who are not going for work are under societal pressure, because the society is such that people will judge you whether you are working. Oh, she is working as a mother. Uh, she's not bothered and she goes for work. There would be other category wherein the female is taking care of the child at home. Still people will judge her. Oh, she's at home. She's not working anymore. See, the society play also, the environment also plays a very important role. Okay, when you're talking about the work life balance, the maternal health issues, everything, the expectation of a boy child, even in today's era, like we have expectations of a boy child, the girl child, what emotions the mothers undergoes. So definitely I have a patient who goes for working, but she has that guilt issues in her. See, guilt issues will always give rise to autoimmune disorders. The mothers usually have a guilt. Oh, I know, I need to give time to the child, but you know how it is. We have to pay EMI of both the houses. So I'm going to work. And I cannot stop thinking this. So again, this would hamper mother's health in some or the other way, right? So at every stage, the mother is facing lot of struggles. But let me also, I would put forth this word that Indian culture is designed in such a way that we have joint families out here. Just a sec. Yeah. So work life balance, like yes. So wherever we was, the mother has to face a lot of struggles. But again, here in Indian culture, we are blessed to have parents, grandparents to take care of the children. So, how should one go about, whether a female can go to work, not go to work? See, initially, a female can, just start something like a part-time job or something like, the corona has really blessed us and you can start working from home. So all these things, start slowly and gradually. You We'll also talk about, just a sec. So this was as far as the mother's health was concerned. But now, since we are talking about Mother's Day, the child is also equally important to mother. So it is very important to provide a health and nurturing environment to the child at home, as it could affect the child's behavior and health. So how this can happen? See, when we are talking about a healthy environment at home, so as Indians, definitely we are blessed to get the love, support from our parents. So as females, definitely the most important role is played by the husband. Nowadays, definitely it's not like the olden days wherein the husband is working out and not caring about the females, the mothers at home. At No, they are equally understanding. Even the in-laws are equally understanding, and most of the mothers do get environment at home which is full of love, support, which is the need of the day. Because if a mother is getting adequate love, nurturing and support the family, then I think the health issues will go on decreasing day by day. So now, not only a mother's health, if we are talking about a child's health, uh, now how a child's again, how will you determine whether a child's behavior and health is perfect or has been taken care of by the family? Yes. Okay, somebody has just put me a question. Does a normal or cesarean delivery have its effect on baby? See, it's not necessary that it will have an effect on the baby. In what aspect are you asking? Are you a doctor, homeopath, or you are a normal person watching this session? Until and unless the child is susceptible to something, then it might have an effect. Otherwise, normal or cesarean section will not have any effect on the body, on the baby. Yes, any other questions? Coming to the most, the burning topic of today, like nowadays we are seeing a lot of hyperactive children. Hardly you will see a child who will sit in a place and have food like in olden days we used to do. So nowadays you will just see children running here and there. Okay, so I've got a question here. What will be the cause if child doesn't cry immediately after birth? So what happens is exactly, Shrishti ji, is when a child cries. Why does a child cry? The God has made it so beautiful. When the child cries after birth, he cries and he sucks in air and the lungs open. See, when the child is inside the womb, he is he gets the oxygen and nutrition through the mother's blood vessels. But once it is out of the womb, it has to breathe independently, right? So when the child cries, it initiates the respiratory system inside the body. So if the child is not crying, the oxygen will not reach to various parts of the body. The oxygen will not reach to the brain, resulting in hypoxia. So if hypoxia is less oxygen reaching the brain. If oxygen doesn't reach the brain, then the child can have various issues because of that. The child can have, the most severe thing can be cerebral palsy, or he might end up having epilepsy issues. All things which are possible because of less of oxygen. Yes, any other questions? Yes. So coming back to, I was talking about nowadays, you are seeing many children which are, hyperactive, normally also, and uh, there are cases which are there of ADHD, attention deficit hyperactive disorder, autism. So these cases are on a rise. So how homeopathy can help? What are these disorders? I'll definitely answer, but the question is just asked what to probe in mother. So in mother, definitely you have to probe about the last 3 months from 7, 8, 9, depending if there are structural issues. So, structural issues you need to probe for initial months history. For functional issues, so if there are no issues except for the child didn't cry after birth, then you can ask for emotional issues on the 7th, 9th. Uh, you can probe, but all these things, this was just like a introductory lecture. Now, less oxygen also, what disorder exactly the child is facing. Accordingly, you can probe in the mother. Okay. So if the child is born with cerebral palsy, then where the mother felt helpless, where did the mother resign to fate? Because paralysis is something you are not able to move, you are totally helpless. So there you can enter the cases through rubrics like, something like resignation or helplessness, depending on the stage of paralysis, whether it is just paralysis or it has reached to the stage of paralysis. So it's a very vast topic, or you can more precise in asking your questions. Then, like, and what is the presentation in the child because of that because of which he didn't cry, and what is the presentation, then I can tell you the exact conflict. So definitely in homeopathy there are, depending on which part of the body is affected, we have a corresponding, questions that you can probe in the mother. Okay. Yeah, anemia of brain can be definitely be thought of. Very good. That would be the pathological. So approach. We are talking about the approach in such cases. If you are talking about the approach, then if it be more like you have to take a pathological rubric, and you have to take uh, the mind, like what caused it. So these two rubrics. So if you want to learn in detail, get back to us. We'll provide you with, approaches in different types of case. Of course, this is not like a ordinary case which can be just approached with your regular case history. Definitely, you need to probe mother's history and the pathological rubrics that you need to probe for. Coming back to ADHD cases, autism cases, majority of these cases that we have seen in our practice, it's usually the discords between the family or discords between the parents being the major cause for the change in behavior pattern of the child, or either of one of the parents is missing in the sense like the child is born and um, suppose the child is very clingy to the mom, and she in the second month itself or third month itself, she goes out of the house, comes late at night, and absolutely no time for the child. Definitely these children can go in for ADHD issues. So um, environment at home plays a very important role, not only for the mother's health during her pregnancy, but even in bringing up the child. The constant fights at home or constant discords between the parents can also affect the child. Overall, the child can be affected. Now, in latest research, if you see, it has been found out like the more the father plays with the children, the more intellect the children are. Now, how is this possible? Now, let me tell you, there is something known as right brain dominance and left brain dominance. Okay, so usually males are left brain dominant, and females are supposed to be right brain dominant. Females are supposed to be more emotional, loving, caring, and males are supposed to be more analytical, logical thinking, um, and they are into uh, intellect work and all. So most, I'm not talking about all, most of the males are right brain dominant, and females are sorry, the other way around. Males are left brain dominant and females are right brain dominant. When we talk about Ardhanareshwar, half is female, half is male. So father figure also plays a very important role in bringing up the children. Okay, so even their absence can cause this absence of analysis, logical thinking in the children. In mother's history, you can get that the mother missed the father because the father was busy working somewhere, or he was not giving her proper time, or she felt neglected by him. So in the child specifically, you will see that the logical thinking is not there, the analysis power is not there, or the child is poor in maths. Okay, so usually in retrospectively, in mother's history, you will get this, that the mother had that forsaken, deserted feeling from the father. So similarly, that was just an example. You tell me the disease, the effect, and we can let you, or there's a detailed studies done about this, and what conflicts or what exactly to probe in that pregnant female or in mother's history during pregnancy, we can help you out. So yeah, the family is very important, the behavior, uh, and nowadays all you are seeing that the children are, I mean, this is the burning problem of today. The children are getting more and more addicted to mobile phones, uh, laptops. They're not ready to go out and play. See, what happens is parents are busy, they are working. So they want to engage the children into something or other. So these are the only things that the parents can give. It's a mobile or a laptop. So the child is busy in all these, and the parents are free to do whatever they want. But if you want the child to be out of this, you need to give your personal time to your children. You need to take out time and play a sport every day outdoors with your children. You need to take out time and play indoor games with your children. You need to take them out regularly, for vacations. Not only vacations wherein you can be at home also, but you need to give that quality time to your children. That will bring down a lot these ADHD and autism cases. So here we can see a mother who is, you know, a multitasker. She does everything. She has to help her out. Okay. So I have got a question. What is the treatment of ADHD in homeopathy? So, in homeopathy, definitely we take the mother's history during pregnancy. We try to probe exactly when this ADHD has started. Has it started since the child has taken birth, right from this? So, one of the most important. Okay, what is the presentation of ADHD that you can make out? Okay, this is a case of ADHD. First of all, the child will not have eye contact. So usually, the child develops the eye contact in second, third month, but here they will either have eye contact develop, and then they will lose their eye contact before the first birthday. So you have to probe accordingly that whether he was born, after he was born, had he developed eye contact. So eye contact stands out a important diagnostic symptom for ADHD. Then you can see, like, if he has by age of a year, if he starts speaking words and after that he stopped speaking those words, then he became hyperactive. He started flapping his hands. There are behavioral disorders. He follows things going round and round. So there we can understand that this is a ADHD case. So in homeopathy, definitely mother's history, or we try to probe the cause why this child had to go in for ADHD. ADHD is the child is cut off from the world. He will be in his own world. He will not follow your instructions. He will not talk to you. He will not play with other children. So, what is the cause for this? We need to find the cause. Considering the cause and disposition of the child can help us to understand what is the cause. Okay, CP child and global development delay. What to probe? So, development is also affected. Yes, any doctors would like to answer. Development is also affected, and the child is also paralyzed. So, what are the things you can probe in the mother? Yes, anybody? Yes, anybody? So, to just give you all an idea, when we are talking about the global development delay, the child is not developing, the brain is not developing. So, what can be the cause? Why the child does not want to grow? What can be the difference? Different question that you will ask the mother during her pregnancy. What will you ask her? Yes, anybody? Achha. Yeah. Fear. Fear of what? Yeah, if it is a contracture, definitely fright, fear you will probe. But development delay, why the child does not want to grow? Why did the mother give the message to the child that you did not grow? What the mother have must have gone through wherein she felt the child should not grow? ऐसा मदर ने क्या फील किया? एंड शी पास द मैसेज कि ग्रो होने की जरूरत नहीं है, क्योंकि अगर ग्रो हो गए तो आगे जाके ये सब प्रॉब्लम्स हो सकती है. सो व्हाट इमोशन शी मस्ट हैव गॉन थ्रू? शी मस्ट हैव फेल्ट, as she grew she had lot of responsibilities. बहुत सारी responsibilities लेनी पड़ी which she couldn't take. One can be that. Second can be she must have been physically abused, because of which she doesn't want to grow. Or there has been strict parenthood, because of which she doesn't want to grow and she doesn't want her child to grow. Or she was never allowed to take decisions. Okay, restrictions itne hain, I am not allowed to take decisions. So then what's the use of an being an adult having good brains? Don't have brains, don't have development. It's better to stay a child. Okay, so according to your situation you can probe in a case. Yes, anything else? Any other questions? Yes. What to probe when a child is functionally normal with normal IQ but has delayed speech? So here the IQ of the child is absolutely normal. If the speech is affected, delayed speech. So where was the mother not allowed to speak in pregnancy? Wherein she was not allowed to raise her voice, or she was supposed to be quiet during something what happened around her. So you can probe for the situations accordingly. Yes. What else? Yes, excellent answers. Clinging can be mother does not want. Yes, exactly. Better to be a child. Yes. Any other questions? So while Mother's Day is a designated occasion, let's strive to make every day a celebration of motherhood. Don't thank your mother only on Mother's Day, but be thankful to her for every day. Let's recognize and support mothers year around, acknowledging their invaluable contributions to society. So again, before concluding, I would ask, okay, so the next question, what to probe if there is delayed teeth development? Now, what is the function of the teeth? See, whenever you want to find out like what conflict to probe for, understand the function of that organ. If you're understanding the function of that organ, then you will be able to probe accordingly. So the previous person asked me about speech. So wherein the mother was not allowed to speak. So here, if there is delayed teeth development, then teeth. What is the function of the teeth? So main function is definitely chewing. Yeah, and some extent definitely it helps in speaking, but the primary function is yes. Yeah, the primary function is to chew. So where the mother during pregnancy couldn't, you know, chew, like chewing caused a problem to her. Chewing in the sense that uh, some situation wherein she couldn't not digest is not the word, but she could not chew that morsel, and accordingly she had issues. So that is why she passed the message to the child that there is no use of teeth. And second function, see, one function of the uh, teeth is to chew, the second is to harm something. Okay, definitely India, as humans we don't harm in humans it is mainly for chewing, but if we consider it the other way around, to harm, and maybe she harmed somebody during her pregnancy and which she thought it was not correct, definitely so she should not have teeth. So the child will have a delayed teeth development. That can be one of the reasons. Any other thing? Yes, any other questions? Any other questions? Okay. So, as we conclude our celebration of Mother's Day, let's carry forward the spirit of love, gratitude, and appreciation. Our deepest thanks and admiration for everything you do. Happy Mother's Day. So, here we end our presentation. Today's special session on Mother's Day. Do let us know what all other topics you would like us to cover to take up in YouTube live. We would love to have your feedback. How was today's session? And what other topics of interest would you like us to take? Okay, thank you. Have a great day.